The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Rotator Cuff Syndrome by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. Today we're going to be discussing rotator cuff syndrome, how to diagnose it and how to treat it. We're going to give you some simple home treatment remedies as well as some simple home diagnostic tools. First of all, what is rotator cuff syndrome? Rotator cuff syndrome is a broad spectrum of disease, from inflammation and pain of the rotator cuff to a full thickness rotator cuff tear, and really anything in between. A lot of times terms in the shoulders are used interchangeably. Rotator cuff syndrome, rotator cuff tendonitis, rotator cuff tendinopathy, even bursitis and impingement. There can be a lot of overlap with this. Essentially, at this end of the spectrum, with rotator cuff pain, inflammation, tendonitis, we throw in bursitis, which is inflammation of the area above the rotator cuff, and then impingement often is associated with this as well. And that's where patients will go up and overhead and the rotator cuff is hitting against the roof bone of the shoulder called the acromion, causing these symptoms, causing this tendonitis and this bursitis. So a lot of the inflammatory conditions of rotator cuff syndrome at this end of the spectrum, with a full thickness rotator cuff tear being at this end. In the middle would be partial tears of the rotator cuff. That can occur on the top surface of the rotator cuff or the bottom surface of the rotator cuff, or sometimes an intrasubstance tear. So patients with rotator cuff syndrome will present relatively consistently with pain on the outside of the shoulder. It tends to be felt more in the upper arm really than up where the rotator cuff is, which is up at the top of the ball. The rotator cuff is a set of 4 tendons attached to 4 muscles. If this is the ball and socket of the shoulder, the rotator cuff comes over the top of the socket to insert on the ball, and that's what pulls the ball up in the socket. You have 2 tendons on the top, you have 1 in the front, and you have 1 in the back. So you have a cuff of tendinous tissue attached to the ball, which moves the ball in the socket in all the different directions that it can move. And then over here, attached to the tendons, would be the muscle that's pulling the tendon up. So when a rotator cuff is torn, that tendon tears completely away from the bone, which we'll discuss. So as I was saying, patients generally will present with pain that's felt kind of further down the arm. Very often they'll have nighttime symptoms which will awaken them. Patients tell me if they roll over on it, it awakens them. Oftentimes they'll have vague and diffuse pain throughout the day, which tends to be increased, particularly with lifting the shoulder, sometimes reaching backwards like getting a seatbelt and bringing it across, or reaching backwards to put a coat on. That tends to elicit pain. Anything up and overhead, so reaching up on the top shelf, tends to be painful for patients. In patients with significant pain and patients with big rotator cuff tears, they tend to have weakness as well. So the arm tends to give out whenever they're trying to reach up and overhead. Generally, even with a torn rotator cuff tendon, patients are able to lift the arm up and overhead. With very large, very severe, and very chronic tendon tears, sometimes they can't. But it's amazing how well patients can compensate even with complete rotator cuff tendon tears. They're oftentimes able to reach their arm up and overhead. Sometimes as they're lowering the arm, however, the arm will give out as the rotator cuff pain increases. Rarely will they have pain that radiates up the neck. Rarely will they have any other symptoms such as numbness or tingling down the arm, and rarely will that pain ever go below the elbow. So the symptoms tend to be relatively consistent. Some self-diagnostic tools that patients can do are put yourself through a range of motion. See if you have full range of motion, including internal and external rotation. Something that can sometimes be confused with rotator cuff syndrome is a frozen shoulder or adhesive capsulitis, which we'll discuss in another video. But one of the telltale signs for diagnosing that is inability to externally rotate the shoulder. Most patients with rotator cuff syndrome have good range of motion. Just be cognizant of whether or not this is causing nighttime pain or pain primarily with overhead activities. If so, then we may be dealing with a rotator cuff syndrome. When patients come to see me in a clinical setting or on telemedicine, I put them through all of the ranges of motion. We check their rotator cuff strength. So an easy way to check the strength of the supraspinatus, which is the main portion of the rotator cuff that's typically involved with rotator cuff syndrome, is to bring the arms out, turn the thumbs down, and have someone push down on both of your arms. If one of the arms is significantly weaker, you may have either a severely inflamed rotator cuff or even a rotator cuff tear. If we're looking at this end of the spectrum, which is the tendonitis and bursitis and maybe impingement, just pain with going up and overhead tends to be painful for patients. You can also get your arm into this position and kind of do this, and that will butt the ball up against the roof bone, the acromion, and that's a test for impingement. And so patients who are prone to that, that tends to be a very painful maneuver for them. Again, in the office, I'll put patients through all of these ranges of motion. I'll also get an x-ray. We'll check for arthritis. We'll check for any impingement, which we can see on x-ray sometimes. We'll check for arthritis of the little joint up here called the AC joint, as well as the big joint, the ball and socket joint called the glenohumeral joint. And oftentimes we'll end up ordering an MRI. The MRI shows me all the soft tissues, so all the things that I can't see on x-ray, the rotator cuff, the labrum, the biceps, and all the other pertinent soft tissues in and around the shoulder. If this just looks like an inflamed shoulder, so if it looks like this end of the spectrum, rotator cuff syndrome, tendinosis, and bursitis, oftentimes in the office I'll offer a steroid injection as well. For complete rotator cuff tears, where that tendon is completely torn off of the bone, there's really no way to get that tendon to heal down to bone without going in and grabbing it and pulling it down, advancing it into the bone and suturing it into the bone. That's done arthroscopically through 3 or 4 poke holes around the shoulder. It's done as an outpatient procedure, and it takes about 45 minutes to an hour depending on the size of the tear.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.